2 o'clock.
Good afternoon, everyone, and welcome to our Tuesday at 2 COVID-19 briefing. We'll be joined by, of course, Dr. Gail Burstein very soon, and have Kendra Schmidt from Deaf Access Services is here, who's providing the American Sign Language. I want to thank everyone for tuning in today. We have some very important updates and information that I think the public will very much be interested in. Just starting out, COVID-19 case data summary. Since the beginning of the pandemic, there have been 78,922 unique cases. These are all individualized. This is through April 12th. 3,298 total new cases in the last week. That's the most we've seen over the last month. We continue to see case growth. That's not good. 359 total new cases per 100,000 residents over the past 7 days. As we know, the CDC considers an area a high risk of transmission if it's 100 cases per 100,000 over 7 days. We're more than triple that. Hospitalizations, as of April 11th, there were 314 COVID-19 patients in Western New York hospitals, 70 in the ICU, 276 patients in Erie County hospitals. Unfortunately, there were 59 in the ICU, 41 on airway assist, and 5 died. And we're continuing to see increases in the deaths as we've seen increases in the cases. And I want to talk about what we know can prevent this. That's vaccines. We have continually been asking the hospitals for updated information with regards to their patient count. Are there any patients in their hospitals that were fully vaccinated or were partially vaccinated? And we're getting the answer, no. There have been some people who've come to the hospitals who've had 1 dose out of 2, but they have not been sick enough to have been admitted. So on the 11th, as shown, there were 276 people that were hospitalized in Erie County hospitals. And according to the information we've received from the hospitals, not a single one of those individuals was either partially or fully vaccinated. Even if they had someone who appeared at their emergency department that was partially vaccinated, they were able to send them home and not be an admitted patient. So this increase of cases that we've seen, we keep on getting the same information from the hospitals. The individuals have not been vaccinated. It's what we've been talking about all along. The vaccine prevents you from getting very sick, hospitalized, and death. So unfortunately, this means the individuals who've died recently, not a single one of them that we know of had been fully vaccinated. And it's very disconcerting because we know there's ways to protect people, and that's to vaccinate them. So we've seen this increase, a 46% increase in hospitalizations in the past 2 weeks, 120% in the last 3 weeks. We got to do better, and the only way I know we can do better is cutting down the risk of transmission and or getting vaccinated. And if you get vaccinated, you're going to protect yourself and your loved ones. 51% of the COVID-19 hospitalizations on the 11th are under the age of 65, so 64 and younger. And here's the look at the new cases on a weekly basis going back to the beginning of March. We've more than doubled on the new cases since the week ending of March 6th, in which we had 1,600 new cases. Now we're looking at 3,400 cases in this most recent week. We've continued to see this growth. We're not in a good situation, is the best way to put it. It's not easy to extrapolate exactly what the percentage rate is, but we know we're definitely much higher, and based on some initial reports that we've seen, because we changed the way we're reporting it, we don't get the full number of cases that were tested by the university systems and SUNY, so we changed it, but we do know that our percentage positives would easily be one of the higher ones that we've seen in the last 3 or 4 months. And all Erie County zip codes have more than 200 new cases in the past 7 days per 100,000 residents. That's double what the CDC recommends that should be, or describes as a significant risk of high transmission, of course, which is very important for schools because you want to be below that 100 new cases in 7 days to basically go back to a more traditional schooling system, and we're not even close to that. New cases by zip code ending of April 10th, you'll see that some of these are very high. We've had a big jump up in new cases in the east side of Buffalo. 14215, which at one point was really high, had traditionally for the last few months had been fairly low, has seen a big increase in cases. Total new cases per 100,000 persons in the last 7 days is 660. I think it's one of the highest numbers we've actually seen. You'll see the 14211 zip code, which is Buffalo, Cheektowaga, so east side of Buffalo, west side of Cheektowaga, 650. Black Rock Riverside, very high one as well, 569. So there's some very high numbers here. And this is very distressing because we know that individuals are getting sick. Some of these people will be hospitalized and some will die. So once again, we have to find a better way of reducing the risk of transmission. We are not back to normal. We'd like to be back to normal, but we are not back to normal. And as I said a few weeks ago, there were people who had not contracted COVID-19 yet who were going to die from it, and that is still the case. There are people still catching COVID-19 who could have prevented it one way or another by either proper social distancing and mask wearing or, of course, vaccination, who are catching it, getting sick, and we know being hospitalized and dying. It shouldn't happen, but it is. With that, I'm going to turn it over to Dr. Burstein to talk about the age breakdowns and what this means for schools.
Thank you. Good afternoon. So this next slide is looking at a table comparing the confirmed case rates, so the number of cases per 100,000 population over a week's time by age group. And then the first set of columns, we're looking at the case rates at the week ending March 20th and comparing to the case rates this past week ending April 10th. And you can see that there is a huge jump between the case rates the week ending March 20th compared to this past week ending on ending on April 10th. So, especially in the younger age groups and people in their 20s and 30s, there's been, a huge increase and almost a 50% increase. So this is a huge concern, and this is the age group that's really driving our incidence, people in their 20s and 30s. So that's something that we all have to be concerned about because that people in that age group are getting infected, spreading disease, their parents, spreading it to their kids and their families, spreading it to their co-workers, bringing it to school, to work, and so we really have to be careful. So this next slide is looking at the proportion of positive tests by age for the weeks ending on March 20th all the way to the week ending on April 10th. And so you can see, again, there's been a progressive increase in the younger age groups, whereas this past week, you can see that our school-age children, people under the age of 18 have had a significant increase each successive week. So again, young people, even though we've always thought that they don't get sick, they don't get infected. If they do get infected, they're only mildly symptomatic. That is not true. We know that there are cases in young people, and they're going to school. We're seeing cases in the schools, and those are almost exclusively among students, not staff. And we are seeing children in the hospital right now. So this is a serious disease for all age groups. So speaking of the schools, this slide is looking at the reports of school-based cases all the way starting from the end of last year, Christmas week, all the way to last week. So remember, last week, most of the schools from grade kindergarten through 12 had off. So they were on spring breaks. And during times when the schools are not in session, they are not required to report. So actually, we were expecting for last week a very small number of school-related case reports because the schools weren't obligated to report. However, despite that, we still saw a significant number of school reports. Actually, the second highest number, where the first highest was the week before. So we had 421 school-based case reports, which is very, very high. And I just want to let you all know that the number continues to stay high. Today, so far, we've received 87 case reports, and these are all students. And then, unfortunately, as the county executive mentioned, there are some people who do fall ill with COVID-19, get hospitalized, and do succumb to the disease. And this is a chart looking at our mortality by age for this year, starting from January all the way through reported cases through April 8th. So these cases, deaths are very, very sad. We want to reach out to the families and friends and give our condolences. However, there is some good news in this chart. First of all, there are a couple trends that we want to note as March compared to February and January had a much slower number of reported mortalities from COVID-19 compared to earlier in the year. So that's good news. And also, so far in April, the numbers continue to be small. One is too much. However, the numbers are continuing to be small. And also, the age group has dropped. So the average age of those who've died from COVID-19 in April is 68 compared to people in their early 80s and late 70s earlier in the year and last year. So again, that is giving us more evidence that the vaccine works, because we know that over 70% of our Erie County seniors 65 and up have been fully vaccinated. So that is something we have to be proud of. In general, this year, so far there have been 477 reported COVID-19 related deaths, and last year in total there were 1,274 COVID-related deaths. So I'm just going to talk about briefly some things that we're doing in Erie County to continue to respond to our pandemic. First of all, we are vaccinating. Again, this is our ticket out of the pandemic. In Erie County, we have vaccine pods. Other clinics in New York State has vaccine pods too. Our Erie County Health Department vaccine pods are at SUNY Erie North, SUNY Erie South, and also the Key Bank Center. We also are having these one-day pop-up clinics, throughout the city and throughout the county to make sure that people that have a difficulty getting out to these pods or feel more comfortable going to a location that's closer to their house has access to those. So remember, even though we're trying really hard to get everybody vaccinated, all the vaccines are by appointment only. So we have a new scheduling system that our county executive is going to talk about. However, you can call our vaccine hotline at 858-2929. So that's the same hotline that you make an appointments, or that if you have a great question you want to ask, it's 858-2929. However, now we have an option to make an appointment for vaccines. So that is really great, something new that we're offering, make it easier for Erie County residents to get vaccinated. So this week we were allocated 7,500 Moderna vaccine doses by the state health department to distribute to our people in our community. So we have all those pods are scheduled. For next week, we have put in our order to New York State. We're trying to get some Pfizer vaccines so we can open up the vaccine pods to 16 and 17-year-olds, try to get those people vaccinated. And of course, we're not going to be vaccinating anybody with Johnson & Johnson because there has been a problem with Johnson & Johnson. So this morning, the CDC and the FDA recommended that we all take a pause on distributing any more Johnson & Johnson because of reports that the CDC has received of a rare and severe adverse event, which actually is a cerebral venous sinus thrombosis. So it's a blood clot in part of the brain. So that occurred in 6 people so far. So just to put it in perspective, so that's 6 reports out of 6.9 million people who have received the Johnson & Johnson vaccine. This is a cerebral venous sinus thrombosis is something that we see in people who are also not vaccinated with a Johnson & Johnson vaccine. The baseline, the incidence that we see in the United States is usually about 2 to 5 cases per million doses, and so this is around the same area as that. So CDC is convening their advisory committee on immunization practices tomorrow, and they're going to meet and try to decide what to do with this information. So in the meantime, we are all taking a pause on the Johnson & Johnson vaccine. Erie County Health Department, we do not have any pods scheduled where we are administering any Johnson & Johnson doses. And we actually haven't received many Johnson & Johnson doses since we have been receiving vaccine. So far, we've only received 2,200 doses, of which 785 were administered by us in our different pop-ups, or we've done a lot of vaccination for homebound individuals. And also we've distributed 1,345 to home care agencies for them to vaccinate the homebound and home limited. We have about 70 doses left that are unused, and we're going to put those back in the refrigerator and not use them until further guidance. Again, we are not going to be receiving any more Johnson & Johnson, and we're hoping to get some more Pfizer. However, we believe for next week, we believe that the state may need to use those for their already scheduled pods that they were planning on using Johnson & Johnson. So stay tuned for next week. And I'm going to turn it over to the county executive to talk about some other great things that we're doing with vaccines and throughout the county.
Thank you, Dr. B. As we said, Erie County has been in the development for some time now, a vaccine registration portal, a little easier to use than the state. And so now there are many different sites in which you can schedule an appointment for a COVID-19 vaccine for Erie County. And we have now activated, as of this morning, the vaccine registration portal, which you can get to at erie.gov/COVID-19/vaccine, and then just click where it says register here. You enter your information. You get to choose your Erie County Department of point of distribution clinic site and select the date and time. So you'll be able to choose of the sites that we have. This will constantly change based on sites. So if we have a pop-up clinic, it may not be there today. Clinic may be scheduled for, let's say, next Monday. Might not be there tomorrow, but maybe we'll actually have it online on Thursday or Friday. So you should constantly check this. But right now, it's pretty easy to get scheduled an appointment in Erie County. There's lots of sites that that have spaces that are going unused, including at our Erie County Department of Health sites. Yesterday, I was in front of a pop-up clinic on Main Street at the Bethesda World Harvest Church. We were trying to bring people in, just walking in, who were walking by. Do you want to get vaccinated? If they did and they didn't have an appointment, we brought them in. So this is another tool we have in our tool belt, in addition to the 858-2929 number. So if people do not have the ability to use the internet, don't feel comfortable with it, you can call us at 858-2929, or you can use our vaccine registration portal, which will hook up to the county sites. It does not hook up to other sites, but it hooks up to the county sites, and that'll constantly be updated as we schedule more sites. And right now, I believe there's 4 sites that are available for 4 different days if you went to that right now for the end of this week and next week. And then there are other locations, of course, on the internet. New York State's Am I Eligible? Vaccinehound.org gives a lot of different sites, including for pharmacies. Vaccinefinder.org also has it. So there are plenty of opportunities to find a site near you. We are doing more pop-up sites across different areas of the county. We'll be coming to other areas we hadn't been previously, including areas of concern that I'll be talking about because of low vaccination rates. But if you want a vaccine dose, you can get it. The doses are available, the appointments are available, and I hate seeing empty appointments not being used, time slots not being used. There's plenty of opportunity to get a vaccine from the Erie County Department of Health or the other providers that are out there. There's no excuse now, other than potentially if you were homebound and you had transportation issues. And you can call our 858-2929 number if you're homebound, and to get on our homebound list too. So do not be afraid to call us. We will vaccine you. We'll vaccine you, give you the vaccine in your home. If you're homebound or you have difficulty with transportation, there are many ways to do it. We've vaccinated, I believe, about 2,000 people in their residences as of right now between ourselves and our partners that go out as part of our task force. Get out there. You get vaccinated. And here's the latest numbers. As April 12th, we were hoping the state would update it theirs through yesterday. They had not yet. But 41% of Erie County residents have received a first dose. Now, we now have exact totals. There's 754,721 residents of Erie County who qualify for the COVID-19 vaccine. Those are 16 and older. So we know that 49.4% of all eligible residents in Erie County have received at least one dose. 27% of all Erie County residents have received a second dose or completed their regimen with the Johnson & Johnson. Based on the percentage of individuals 16 and older that qualify, that means 1/3, 33.2% of all eligible residents have completed their vaccine dosage. This is huge. We are really starting to see a ramp up in our numbers, and it really, we should see a reduction in our hospitalizations. We should see a reduction in our new cases, but what we're seeing is there's a certain percentage of the population that was not getting vaccinated. Whether they do not want to get vaccinated or they've had difficulty getting vaccinated, the spots are available now to get vaccinated. I want to see these numbers really increase. I want to see these actually be 100% in all categories. That would require everyone to get vaccinated. And the opportunity will be there through the remainder of spring and summer to vaccinate everyone. Our Department of Health has administered 54,092 first doses, 37,680 second doses, but it's important to say, roughly 50% of all eligible Erie County residents 16 and above have received at least one dose, and 1/3 of our citizens have completed their vaccine regimen. There's still a lot of people to vaccinate, but there's lots of appointments available for people to get vaccinated. Here's a disappointing thing we continue to see, which are low vaccination rates in certain zip codes of our community. Some of these are just unfathomable in my eyes, but we also know that some folks have transportation issues. Some folks have questions as to whether the vaccines are safe. I got my vaccine, I got the Pfizer vaccine, no issues. Some people have had side effects after the vaccine, but that's a good thing because it shows that your body is reacting and creating antibodies. You will be protected. The vaccine distributions are very disappointing. Look at some of the zip codes in the green, the suburban areas, where the percent of their population has one dose is over 50% and near 60%. A couple, Sardinia is exceptionally high, 88. There's only a couple hundred people that live in that zip code. But depending on where you live, it has a huge impact on whether or not you've been vaccinated with at least one dose. And we are doing pop-up clinics in these areas of concern. We're going to be doing pop-up clinics in some of the southern parts of rural Erie County, the town of Collins, near the village of Gowanda. We're planning on doing some clinics there in the future. We're planning on returning to the town of Concord, village of Springville. We're also looking at other areas that are low on this list, like Alden, Holland, and then we're also going to continue to focus on Buffalo, Cheektowaga. These areas we're going to be thinking about, we're going to be opening up. We haven't announced it yet. We're going to be looking at a clinic, doing a pop-up clinic in the South Buffalo 14210 zip code because we want to hit these areas of concern. And it's just very disappointing to see, depending where you live, is a much higher chance of getting vaccinated. We know that it's not just because of where you live. There's a lot of other reasons behind it, but it is really disappointing to see that our more affluent areas have much higher rates than some of our poor areas. Our rural areas have lower rates than we'd like them to see, and also that's a big issue. It's transportation because of the lack of potentially having sites out there. We've been down south. We're continuing to be down south. We actually have a pod going on right now at the Seneca Nation in southern Erie County, a closed clinic for the Seneca Nation. We're trying to increase those numbers in the south, deep south towns, and we will continue to do that. We're going to be working on this all summer. It's as simple as that. We know we're going to be vaccinating all summer because eventually we're going to be vaccinating children as well. Public Health Lab, if you're sick, get tested. We've got spots to test you. Call 858-2929. Know your status. If you're not feeling well, if you got the symptoms of COVID, fever, chills, difficulty breathing, there's so many symptoms now, including stomach issues, diarrhea, call. We will test you. PCR tests available results in 1 to 3 days. Point of care rapid test, you'll leave if you get a point of care rapid test knowing whether you are positive or not. Appointments are available. You need to have an appointment. Call 858-2929. Now, we know we want to return to normal. Nobody wants to go through what we've gone through for the last year plus. We want to get back to the days when we are like we were 2 years ago. And unfortunately, it's still going to take a little work to do that. This fall, of course, we're going to be cheering on the Buffalo Bills at the stadium. And I want to see that stadium full. I know the Bills want to see that stadium full. We want to return fans back to the stadium. That's why the county supports returning all fans to the stadium and arena for this fall. So returning fans for the football season that the Bills have, the new hockey season that the Sabres have. There's a way to do this. We know there's a way to do it. We know there's a way to ensure it. That's that all fans and staff are fully vaccinated. That's why I'm announcing now. Our plan is that unless you are vaccinated, you will not have entry to the stadium. It is easy. It is safe. We can then guarantee 70,000 plus people at the stadium enjoying the Bills, cheering them on. I know Josh Allen, Tre'Davious White, the whole team, they want the full stadium. It was loud last year. I can't imagine how loud it'll be next year with 70,000 fans. You can be one of those 70,000 fans by getting vaccinated. It's as simple as that. That's what we want for the stadium and the hockey arena, which are both owned by Erie County. We work with the Buffalo Bills and the Buffalo Sabres to ensure the safety of all who enter, and there's a way to do it. Get vaccinated. You don't need to get tested. I just put on my phone yesterday the New York State Excelsior Pass app, which allows those to show that they were vaccinated, and you just show it. You get your little QR code, which they then scan, and it determines, yes, this person is safe. This person is not a threat to other individuals. We had a lot of complaints about people saying, why do I got to get tested to go to a football game? Why do I got to get tested to go to a Sabres game? And probably as we move forward with baseball season, why do I got to get tested to get into to see a baseball game? Well, you won't if you get vaccinated. Our goal is to have a 100% full house for the Bills and the Sabres starting in the fall, and that's ensuring everybody who enters that facility, the fans, the staff, are fully vaccinated. We're going to ensure from the county staff that's there, and we want to ensure that if you want to go to a Bills game, you can buy a ticket and you can enter by showing that you are vaccinated, just like I have here. And by doing that, we will have a safe environment where no one's going to have to worry, am I sitting next to a person who's got COVID-19 and can give it to me? Or am I at risk because I tested 3 days ago, but maybe I caught it a day ago? There's a way to prevent it. We know people are not being hospitalized because they have COVID-19 because they've been vaccinated. It's as simple as that. Our goal is to return fans to the stands in the football stadium later this year, as well as for the hockey arena. And the way to do it is to ensure that everybody who has a ticket has an Excelsior pass. You show your phone now when you go and get your tickets. Most people aren't coming in with paper tickets anymore. They're coming in with a QR code that's scanned. You could have another QR code on your phone that's scanned to show this individual, this one here, Mark Polenkars, is fully vaccinated. That is our plan. I've talked it with the Bills. I believe they support it because we want to see all our fans back in the stadium this year. It's our stadium. It's owned by the people of Erie County. Our team plays there, the Buffalo Bills, and we want to ensure it's a full house, but it's a safe house for all. And if you elect not to get vaccinated because of your own personal choice, well, it's your own personal choice. When you buy a ticket to a football game or a hockey game or a baseball game, it's a license to enter the facility. You can be removed at any time for any reason. You don't have to have the right. You often hear that freedom isn't free. Well, I agree. Freedom isn't free. Our men and women have fought for it to protect our lives and to ensure what we have going forward. I want to ensure that when people go to a game, it's a safe environment in the fall. And if 25 or 30% of our population is not vaccinated in the fall, we're not going to be able to have 100% of the people back in the facility. It's as simple as that. But if people are vaccinated, we can get 100% back if everybody's vaccinated. And I hope everyone will. spots are available. Call us at 858-2929 and we will get you into a location at the KeyBank Center today because there's still appointments available today. And I think we're there till at least 5 o'clock? 7. So if you're watching this and you haven't been vaccinated, you want to get vaccinated, you want to go to a Bills game later this year, get vaccinated. You'll get your first dose of Moderna vaccine today. You'll get your second dose of Moderna vaccine in 4 weeks. 2 weeks later, you'll be able to fill out the pass. And in the fall, you'll be cheering on Josh Allen at the stadium. With that, I'm going to open it up to questions from the media. And I think we started with print media last time, so we will start with television media this time. Actually, we'll go with radio. I don't know if I ever started with radio. So we'll start with radio. Is Mike Baggerman, WBEN.
Mark, I'm honored that you picked radio first this time. This is a big thing going on.
It is a first, I think.
So obviously, with this news today about the requirement of the vaccination, I'm curious because you're talking about that Excelsior app that a lot of people have a distrust of it for whether it's cybersecurity purposes or whether it's just the idea that this is a government app that they want. Do people have to have that app in order to get into Bill Stadium, or are there other ways that they can show that they've been vaccinated in order to get in?
Our goal is to use them through the app. And for those who wonder if government knows whether I've been vaccinated, government knows. The app is tying into our system. We know if you've been vaccinated. We know if you haven't been vaccinated. That's the beauty of the system today, is it allows the sharing of information among healthcare providers so our Department of Health can know it. The hospitals can know it. So for those who are like, oh, I don't want government or other people to know whether I've been vaccinated, if you're using healthcare in New York State, the healthcare providers have a right and access to get your information. So for those who are like, oh, I don't want to do it because government will know I've been vaccinated. If you've been vaccinated, we already know. We can already know it. This will ensure that it's a safe environment so that people can come. Our goal is to use the Excelsior app because we know that is this app that works. It is safe, and it is utilizing the system that already exists through the New York State Department of Health. And when we enter information, when somebody gets vaccinated, or for that matter, when they just schedule an appointment, that information automatically goes to the New York State Department of Health. And when they get a vaccine dose, that goes automatically to the New York State Department of Health. And then it goes into the central system that we can access later. So for those who are thinking, oh, I don't want anybody knowing whether I got vaccinated or not, healthcare providers can know through the system that exists. It's called the NICES system, and we are part of it. And we can look up. Do we do that? No, it is not something we do. We do not look into people's vaccine status. But we could if somebody came to us and said, hey, I need to check on my vaccine status. That's like we said, if you lose your green card, your white card, you can come talk to us in Erie County and we can give you a new card because we can access the system to determine whether or not you were vaccinated. So I just want to put that out there for those who think we don't have access to the system. We actually do. And all healthcare providers do. And I think it's important that the public understands that. And we want people back in the stadium. It's as simple as that. We want people in the hockey arena. I want to get back to normal as quick as possible. And the best way to do that is to vaccinate everyone. WBFO radio, is anybody on?
In terms of what you were talking about, what Dr. Burstein was talking about earlier on the J&J vaccine, you've been using that for homeless people, people who are confined to their homes. Is this going to seriously interfere with getting people who are confined to their homes vaccinated, getting the homeless vaccinated? Is this a serious segment of the vaccination field?
Well, we've been using it, as you noted, Michael, solely for homebound or these very difficult populations to reach, such as homeless. We haven't been getting a lot of it. It's not like we're getting thousands of doses in J&J a day. Actually, New York State had been retaining a lot of the J&J doses for their own clinics. So I think New York State's been put in a bind because they're the ones who've been predominantly administering the Johnson & Johnson. So for us, it's less of an issue. As we said, we've had no public clinic scheduled for Johnson & Johnson, so it's not like we have to transition over. We've had some private parties that we work with, VNA, Home Care Associates too, Buffalo Home Care, that have been going out. We've been sharing. We're going to be providing Moderna doses to them for a clinic that they had scheduled today that was going to use J&J. It is a problem if it gets allowed again very soon, then it won't be much of an issue. But if this is taken off the market, so to speak, for months, then it'll have an issue. But it makes up such a small percentage of the doses we administer. It's not as if we're going to have to shut down clinics that we scheduled for the public, because we had no clinics scheduled for the public that were Johnson & Johnson anyway. Hannah Bueller, WKBW. Anyone there from WKBW? If not, we'll go to Spectrum News. Andy Young, Dominic Lavello.
Hi, Mark. Andy Young here. Just wanted to know when exactly this plan for the stadiums will go into effect. Will that begin before the Bills preseason? Could that involve the Bisons in any way? And also, would it have any religious or medical exemptions?
At this point, we are planning on trying to implement this before the preseason, which of course is either late July or August. I'm not exactly certain what the schedule is off the top of my head. I know it has been out there, and with the additional game that was added. Our goal is to ensure that everyone is in there, so 100%, so there would be, my goal, no exemptions. I know some people are like, well, that's unfair, but there's no God-given right to attend a football game. There's no right to potentially put other people at risk because of illness. So for us, the goal is to ensure that it's a full house that is safe and secure, and we know now everyone can watch the game. It's not like there's a blackout. You can watch the game from home, but if everyone gets vaccinated, we won't have to worry about the individuals going to the game. We won't have to worry about potential spread to team players and things like that. Our goal is to ensure that that site is 100% safe, starting for the preseason, which of course would go into effect in July. The reason I'm talking about it today in April is we want this out there now, so there's plenty of time for people to get vaccinated. There's plenty of time when the tickets go on sale for people to understand that if they want to go to the game, they need to be vaccinated. We're not announcing this 2 weeks before the season starts, so that they have the understanding of that. Right now, of course, the Bisons will be playing in Trenton, and other discussions are going on, but we want to see full houses for every sporting event, but that would require everyone to be vaccinated. There are two facilities that are owned by Erie County. The football stadium and the hockey arena are both owned by Erie County. We do not own the baseball stadium, so it's a little different situation, but we'd love to see 100% at the baseball stadium too when games resume. But to do that, the only way you're going to get 100% people in the baseball stadium is if they're all vaccinated. Marley,
and then would this require state approval as well?
We don't believe it does, because this is our facility that we're own, and if everyone's vaccinated, then it's a safe facility. But the state does not approve most of the things that, actually, the state approves almost nothing that we do at the facility. I'm fairly confident the governor will probably say otherwise, but they approve almost nothing. Dan, something's going on over here. But we own both the football stadium and the hockey arena. We have reached out I have reached out to the Bills organization and let them know, and I believe they're supportive of this. It's the goal is to get full house, so that we're supporting our team. And the only way to do that, to ensure the safety of everyone, is to be fully vaccinated. And truthfully, if everyone's fully vaccinated, there really should be no concerns. It's not like you need to be at 50% or 70% if everyone's fully vaccinated. That's the goal, to reopen everything. And to reopen it, it's to ensure that people are vaccinated. Marley Tuskus, Channel 4.
Mark, I wanted to follow up with this. Obviously, with this plan going in place, how does this affect the players or the coaching staff at all?
I don't want to go into particulars associated with the teams. The teams do have their own restrictions in place. I think it's important that you would talk to the teams about that. Our goal is to ensure the entry of the individuals who will be sitting in the stands and will be working at concessions and security. I know that there is a high level of concern with regards to COVID-19 transfer among the teams. Last year when we had a football season, we didn't have vaccines. We have vaccines now. So when they were doing the constant testing and so forth, there was this serious concern about the players and the coaches getting ill, and a legitimate concern because there were many people coming together on a daily basis and then playing their games. But if I would hope that all players and all coaches, all staff for the teams are fully vaccinated. We've actually, as part of our work with the KeyBank Center, we have been vaccinating staff associated with the Buffalo Sabres. I know the team is planning on getting players vaccinated very soon. They've not all been vaccinated, but the goal is to make certain that every player gets vaccinated before they leave from the end of the season. So our goal is to ensure that everyone that will enter that facility, regardless of whether they're on the field or sitting in the 300 level at the arena or the upper deck at the stadium, is fully vaccinated. Kelly Dudzik, Channel 2.
Going back to the Johnson & Johnson news today, and even though it's a small percentage of the vaccines being distributed by the county, how do you combat any vaccine hesitancy that might come from that news, especially when you're dealing with certain zip codes where you have openings and you have appointments available and you need to fill them to get those numbers higher?
It is disappointing that this, but the most important thing is to ensure the health of everyone who's getting the vaccine. So the CDC and the FDA took a pause, and as the doctor noted, it's 6 people out of 6 million plus. So it's a very, very small percentage, but it does need to be looked at. We know from the Moderna and the Pfizer that there has been really no response whatsoever. Some people have had side effects, but not to the effect that there's a serious concern, and there's been tens of millions of more of those vaccines provided than the other. So I think it's important. I'm going to turn over to Dr. Burstein for her comments as well. But we've been administering the Moderna and the Pfizer, and we know that's safe. We've been administering small doses of the Johnson & Johnson, and we've had no issues that we're aware of here. I just want people to understand, I got the Pfizer. I wouldn't have put it in my arm if I didn't think it was safe, but it's safe. My parents got it. They think it's safe. It's safe. They haven't grown a third head. My family, other friends of mine, coworkers, I know of no one who's had a horrible issue where they've required hospitalization or anything because of the vaccine. Some people have gotten sick. I'm not going to deny that. But I want people to understand that the vaccine saves lives, and we know that. The vaccine will prevent you from being hospitalized. We know that. The vaccine can ensure a bright future for all. If you don't get it, you could die, and in the last 3 days of hospitalization data, 14 people died. And if they had gotten vaccinated, I don't know why they didn't, but if they had, maybe they'd still be alive today. Turn it over to Dr. Burstein.
Thank you. So just to give you some other information to help you put it in perspective, first of all, this has only been a complication of the adenovirus vector vaccines. So the Moderna vaccine and the Pfizer vaccine, those are both mRNA vaccines. So those are a different type of vaccine technology than the Johnson & Johnson or the AstraZeneca that has also had some problems with blood clots. So the vaccines that we are giving now in the United States, the Pfizer and the Moderna, are mRNA vaccines, and those are very, very safe. They have not had any documented complications with any type of blood clots. Number one. Number two, these cerebral venous sinus thromboses, these rare blood clots that people have developed in association with the Johnson & Johnson vaccine, are this is a rare event. However, we do see this in the United States. Again, the incidence in the general population is 2 to 5 cases per million population. So again, with these cases associated with the Johnson & Johnson vaccine, were 6 cases per 6.9 million people who received the vaccine. So those numbers, those rates are very similar. So it's, so the Advisory Committee on Immunization Practices is meeting tomorrow to try to tease out a little bit more information and make a decision on, is this similar to the baseline incidence of this complication and we don't have to worry about it? Or do we really need more information and need to do some data mining with the already established vaccine safety databases that CDC has and can use. So, and another piece of good news is that it shows that our post-marketing vaccine surveillance is working. So this is a rare complication. It's so rare that we would not find it in as a complication in the randomized controlled trials, because although they had many people involved in the trials, I mean, it was 60,000 people, it really wasn't enough to see this rare event light up. So through our national surveillance system for vaccine safety, we were able to find this as a possible problem. And so that shows that we are able to clearly detect and determine if a vaccine is effective, and more importantly, if a vaccine is safe. So our safety net is, for looking at vaccine safety, does work. So if people have received the Moderna or the Pfizer vaccine, you can be rest assured that the vaccine that you received is safe. And we know from our hospitalization data and our mortality data that it also is affected. With the Johnson & Johnson, there is a chance that there could be a higher incidence of this rare complication of blood clots. However, we don't know that for sure right now, and we're leaving it up to the scientists and the epidemiologists to tell us. So we're forging ahead with giving out our Moderna doses this week and next week, and we want to get to that really high. We'd love to get to 100% protection. We've also heard that Pfizer is submitting data to the FDA to get emergency use authorization for kids between the ages of 12 and 15 years. So hopefully there'll be a new population of young people that will be able to vaccinate soon. So I think in the big picture, there is good news in this. So thanks.
Okay, Sandra Tan, Buffalo News.
Hi, Mark. Thanks. So just last week, you were saying that vaccine eligibility does not equal availability, but I'm wondering if you still feel that way, especially given the fact that it sounds like you were among the people who are encouraging people walking down the street to get the vaccine at your pop-up clinic at the Bethesda World Harvest Church. And just looking at the website for KeyBank available appointments, there still seems to be many spots available for pretty much any time all day. So have we reached a point now where the focus is less on making sure people can make an appointment to actually encouraging people who haven't yet made an appointment to go get vaccinated?
Yes, your question, the latter. We were very worried that when they announced the increase to 16-year-olds, that we would not be able to meet any of the demand for the near future. We don't have the Pfizer, so that's a problem, so we can't do 16 and 17-year-olds. We can only do Moderna because that's 18 and above right now. But what we've seen in the last week has been a tremendous slowdown in the number of people who are getting vaccinated and signing up for clinics. We think there's still going to be demand. People are still going to be showing up at clinics. But we are a little surprised at what we've seen in the last week. I've talked to some of my colleagues across New York State, and depending on where they are, some of them have said there's still high demand. Others have said it's really slowed down. So I'm a little surprised that we've seen this rapid move from just so much demand and not enough appointments to where we have walk-in status. If you want to get a vaccine right now, you could walk over to the KeyBank Center and we'd do it. We tried to get people in off the street yesterday. We've been doing that. I know the clinic that was scheduled for Gowanda today, we were anticipating and trying to do 500 people, and you only had a couple hundred people guaranteed. So something's going on out there, and it's worrisome because we know that the percentage is such that while it's great that about 50% of our population that's eligible has gotten one dose and 1/3 of it had the full regimen, there's a whole percentage of population that don't seem to be interested in getting vaccinated. That's a big concern because we will never get back to normal if we have 40% of our population that is unvaccinated. We will never hit herd immunity. We'll still have cases and cases and cases of new COVID cases as long as there's enough host, so to speak, for the virus to take hold. And the other thing we're dealing with right now, which is why I think it's very important that people get vaccinated if they haven't, is we have these variants here that are much more transmissible. And there's still a question as to whether the variants are as good for a couple of the vaccines are as strong for variants as they were for the original COVID-19. So get vaccinated to protect yourself. And if you're not willing to get it, then you're really putting yourself at risk. After all we've seen, about 1,800 county residents who've died as a result of COVID-19, I would have thought everybody would have wanted to get vaccinated. Some people are choosing not to. And if they do that, that is their own personal choice, but they are also putting themselves and others that they may live with at risk. It's concerning, very concerning, Sandra.
Just quickly to follow up, does this mean maybe the county needs to pivot to more of an education model to get folks who might be really unwilling to get the vaccine or hesitant to get the vaccine, to do more outreach to them to kind of push them in the right direction?
We are doing that. We have actually started this week radio commercials on WBLK, WYRK, and later this, I think it may start tomorrow, on WUFO radio, so areas of concern where there's been low vaccination rates, both in inner city of Buffalo as well as the rural areas, stations that are very popular in those communities. We are doing radio commercials. New York State has certainly upped its radio and television commercial game. We are talking more, just as much as we have. I don't know how we could talk more, but we've been reaching out to faith-based leaders and others in the communities to get individuals, to get them vaccinated. We cannot force somebody to get vaccinated. And if they don't want to get vaccinated, that is their personal decision. But they do not have the right to put other people at risk. They don't have the right to say, I'm not vaccinated, I'm going to go to a football game in the fall and then potentially expose many other people and then be coughing all over the place because they caught COVID-19 3 or 4 days before. I think it's important that people understand that they want to return to normal now. Our numbers are not good. Our numbers are ugly when it comes to cases, not vaccinations, but hospitalizations and deaths. I mean, the chart just shows this increase in hospitalizations over the last 2 to 3 weeks, 46% increase in 2 weeks and 120% in 3 weeks. And we contact with the hospitals. I go directly to the CEO, so does Dr. Burstein. She goes to the chief medical officers. They give us information, such as we know no one is, of those 276, 262 the last couple of days, had been fully vaccinated. We know it from looking at the nursing home statistics. Nursing home cases have dropped to almost zero. We almost never see a nursing home death anymore. Why? Because the nursing home patients have been vaccinated. The same thing with the assisted living facilities. Vaccines work. We have the data to show it works. So for somebody to say, I don't want to do it because I'm afraid of what may happen, well, we've got months of data to show it works. This is not political. This is about people's lives. And I know people who months ago lost loved ones who wish they had the vaccine for those loved ones to give them so they'd still be alive today. I guarantee you, today's what, April 13th? I guarantee you, on the Tuesday, if we have a Tuesday at 2, the week of May 13th, we're going to be releasing hospitalization data, and people will have died that week who probably would have caught it this week or the next week. You can protect yourself. Be safe. Get vaccinated. Okay. Anybody else we haven't called on?
Hi, this is Hannah Bueller with Channel 7. Sorry, I had a problem with my mouse.
Sure, go ahead, Hannah.
During the previous question. So with the whole Bills Stadium thing, is that something that you guys are, the county has the final say on, or what are those discussions with the Bills at this point? And, I mean, is it set in stone that people need a vaccine to come to the game?
It is our intention to move forward with this plan. The county owns the facilities. The county health department authorizes the sale of everything at the facility when the food and stuff like. We work with the Bills all the time on all kinds of issues, just like we do with the Sabres, which the arena is owned by the people of Erie County. And our goal is to ensure a 100% safe environment. I mean, people know, people get thrown out of the stadium every game for breaking the rules. happens every game. People are tossed from the stadium for various reasons. It could be as simple as smoking a cigarette. Smoking a cigarette in the stadium will get you tossed from the stadium. And we've caught people doing it, and they're like, oh, I had to have my cigarette. Well, you just got tossed from the stadium because it's illegal to smoke in the stadium. Same thing with the hockey arena. If you got caught smoking in the hockey arena, which doesn't happen, at least to the stadium issue that we've dealt with, you get tossed. So I know people are like, wow, that's pretty strict, but we're trying to protect not only the people in the stands, but the players on the field, the concessionaires, our sheriff's deputies, the security guards. And the best way to do it is to ensure everyone's vaccinated. That's how we're going to get out of it. It still boggles my mind. I was reading a book last year on, actually it wasn't a book, it was a digest, on polio vaccine and how people took the polio vaccine because they realized how bad polio could be. And within a very short period of time, we eradicated polio pretty much as a problem. Same thing goes on with smallpox. You don't hear about smallpox because we eradicated it from vaccines. And now people are like, we have an opportunity to protect ourselves against the greatest viral killer we've seen in 100 years. And people are like, I'm not going to do it. And you can't prevent me from going to a football game. Well, we want to ensure the safety of our public. You have no guaranteed right in the Constitution to inflict illness on other people, just like you have no guaranteed right in the Constitution to attend a Buffalo Bills football game. It's a license when you buy a ticket. It's granted, you can be removed at any time. Our goal is to ensure that everyone in there is safe. So yes, this is our plan moving forward. Okay. One more round, see if we can get it quickly. Back to WBEN, Mike Baggerman.
Yes, this is again about the requirement that people need to get the vaccine in order to go into the Bills Stadium. I'm seeing some questions about this in regard specifically. How is this going to apply to kids, and how does this also apply to anybody who's trying to go to a game who doesn't even live in New York State, whether they're from Canada or Ohio or anywhere outside of the state?
Well, that's something we will deal with as we go through this. We certainly have time to do that. Right now, Canadians cannot cross the border. I'm hoping that by September we can all cross the border, but it doesn't look like that's going to happen in Canada anytime soon. It's quite apparent that we have individuals who do travel from outside the area. Well, we want to ensure that they were safe too, and we'd have to do that through a mechanism that allows it. We have plenty of time to do this. Children, we fully expect that as the authorization is given for children to be vaccinated, that they will have plenty of time to be vaccinated this summer. As we know, Pfizer has requested vaccination for, I think, 12 to 15 at this point. Moderna has asked for vaccine. They haven't submitted it. It's coming, but Pfizer's asked for 12 to 15. I would not take anybody under the age of 12 to a football game. This is not a place where you want to have a kid. It can be a little raucous there. But regardless, we feel that most of the summer we're going to be vaccinating children because we feel like we're going to be in a pretty good position, certainly by the end of May with regards to adults. I did not mention it, but we roughly have 3/4 of all 65 plus have received at least one dose so far in Erie County. So 3/4 of all our residents 65 plus have received at least one dose, which is higher than the New York State average and goal. So we've done pretty well with seniors. Seniors get it. They're getting vaccinated. Not every single one has. But our goal, and we've got plenty of time. This is not like the football games being held in 3 weeks. There's no spring football for the Buffalo Bills where the fans are. So our goal is to work through this to ensure that everybody who walks in that facility is vaccinated, and we are able to access it through the Excelsior Pass. WBFO. Michael, you there? If not, we will go to Kelly Dudzik, Channel 2. Any more questions, Kelly?
Sure. That 20 to 39 age group that is getting sick now, is that because of the behavior of those people, or is that because they aren't vaccinated yet, or a combo of both? And what do you have to say to younger people to make sure they're staying safe?
I believe that the information I've seen is both, Kelly, that younger people are having behavior that's putting them more at risk, and they have not received vaccination levels at the same rate as the older ones just because they've been eligible. But I'll turn it over to Dr. Burstein as well.
Yes, thank you. You are spot on. So we know that our vaccination numbers are not as high in the 20 and 30-year-olds as compared to where they are, say, in older people. Also, more our 65 plus, as the county executive says, have very high vaccination rates, at least for the first dose. And then also, people with comorbidities, where there's a higher proportion of those individuals in the older age group. So we believe that they've had a longer chance to get vaccinated. Also we're seeing a lot of transmission in the workplace. Where people in their 20s and 30s work. So we're seeing a lot in restaurants. We're seeing a lot in daycares. We know that many of the workers in those places are in their 20s and 30s. Even in other businesses, like within cubicles. We're also seeing a lot in churches. So, we know that it's a combination of vaccine and behaviors. And there's something that we can do about both. So we can make sure that we, get vaccinated. We, as the county executive said, we have a lot of availability of vaccine now. There is a dose of Moderna waiting for you this week. So please call and make an appointment or go online and make an appointment. Also, get your mask. They can be different colors, fun to wear. Make sure you still social distance, 6 feet apart. If you're sick, stay at home. Don't go near anybody that's sick, and keep your hands washed. And then know your status. Get tested. We have plenty of available of testing at the Erie County Health Department's Public Health Lab, both rapid tests and molecular PCR tests. So please do. The fight's not over. Our numbers continue to stay high, and the only way we can get out of it, and we do have control, is by changing our behavior and getting vaccinated. Thanks.
Mike Desmond, can you hear me this time?
Yes.
Okay, question. Irving, Gowanda, possibly out in the eastern end of the county. Any chance these numbers are a little skewed because members of Seneca Nation go to the Seneca Health Authority? I imagine there's some Indian Health Service equivalent for the Senecas, Tonawanda Senecas. Any chance that these numbers are a little skewed because you're not getting data from the Seneca Nation and the Tonawanda Seneca band?
We do believe that these numbers are off. These are the numbers that are received by New York State. We do think there may be some issues. So that's all we can add. There's a lot of, Gowanda also includes Cattaraugus County. We're not certain if people are being misidentified as such, being the village of Gowanda is one of the only villages that I'm aware of that's actually in 2 counties. We've had villages that are in 2 communities, 2 towns, but Gowanda is actually in 2 counties. So we think there is some skewing there, but we're also down. There's a reason why we're down at the Seneca Nation today with a point of distribution pop-up clinic, is to ensure that we're giving those who want it the opportunity. I don't know for certain the Seneca Nation as an independent nation. It is not a jurisdiction of the state of New York, as we know, and there may be information that is just not being provided as such. And I also will note the Native American nations have been working through the federal government also to receive doses. So it's not as if some of these folks were not vaccinated. They may have been vaccinated through doses that were provided by the federal government through a program through there. And I would assume we would have gotten information on the percentage of people, but maybe there's something off because of the issue associated with the territories. Marley Tuskus. Any more questions?
So, yes, sorry, I was trying to unmute my mic. Just to clarify, did Dr. Burstein say the 87 cases reported in school today were all students?
Yes, she's shaking her head, yes.
Yes, okay. So while we're also seeing these large numbers of positive cases in schools, the state is now expanding and looking to hold proms and commencement ceremonies. Any concern with that as we get into this kind of, graduation and prom season?
Yes, of course. Certain concern. I mean, most of these children cannot be vaccinated yet. 16 and 17-year-olds could if their Pfizer's available, but most children cannot. So that is a concern when we're seeing these increasing cases in schools. We're seeing the increasing percentage of cases by region. I mean, we like to say, hey, we're number one, but right now, last I checked, we're number one on the worst new cases for New York State, and that's terrible. I don't know if we're going to see a further shutdown or not. I would hope not. But it's in the people's hands. And if people are just continuing to act like this is over with and getting ill and passing it on to others, and people are getting hospitalized and dying, well, then that's something really bad that we need to address. And we can only talk about it. We can't control people's behavior short of shutting everything down and locking them back in their houses, which nobody wants to do. So, yeah, I'm concerned. I know the health department's concerned about proms and graduations. I would hope that there's alternatives to these that can be done that are in a safe manner. Graduation, I think there's alternatives to be able to do that in a safe manner rather than have it indoors at an auditorium. So it's something that our health department is, of course, always looking at. We do not review plans from schools. New York State does not review plans from schools. The most recent guidance that came out last week, it's not like we go out there and give a rubber stamp of approval, but we do work with the schools. We have a school team and our epidemiology staff that works with the schools to address these concerns. And if we believe that a school needs to be shut down, whether it's a grade school, middle school, high school, we make that recommendation to the school district, and hopefully they follow up on it. So if there is a school of concern, actions taken to go virtual, nobody wants to do it. People think we want to do this. We like shutting things down. We don't like shutting things down. I mean, we've all spent the last 14 months, 15 months basically focused on this, coming in almost every day until at least late summer, every day, Saturday and Sunday, working 12-hour days, 14-hour days to protect lives. Same thing when we saw an increase this past winter. We were coming in a lot, long hours to protect lives. I don't want to go through it again. I really thought our numbers would be going down. I didn't think we'd be seeing this mass increase, but it's going up, and it's going up in all locations. And that's why I say, get vaccinated. Please get vaccinated. Hannah Bueller? Anything else? Andy Young, Dominic Lavello? Anything else?
Yep, Andy Young here again. We've had some questions lately about transmission in schools and how school cases are counted. Specifically, people want to know why cases where transmission likely occurred outside of school. We hear about sports teams. We heard the doctor talk a lot about spring break, yet cases were counted towards school cases. Can you explain the rationale behind that, the reasoning behind that?
Well, we don't necessarily identify them as transmissions in the schools, but we identify them with regards to the individuals that are in a school. So if you have a hockey team, which is pretty much over with, except for club hockey, and you have one player who is positive, and let's say they were at a practice the night before, and they were not feeling well, and they get tested positive, I know how it is from coaching hockey in a locker room. That one player could have transmitted it to every other player in the team. So you've got to basically go in a pause. And if there are direct close contacts, then those have to be quarantined. The same thing happens with schools. We don't shut down a school just because one or two, three students has test positive. We shut down or make a recommendation to shut down a school because there's a growing trend which shows multiple cases. It doesn't necessarily have to be a transmission in the school, but I'm guaranteeing you, I'm saying this right now because there's a lot of false information out there. We have seen transmission in schools. Doesn't mean there's hundreds of cases, but for those who are like, there's no transmission in schools, that's false. Doctor, would you like to add anything? And so we're just trying to protect everyone. And it would be silly to have 10 cases turn into 25 cases to turn into 50 cases and not have shut that school down. And then people say, you missed the boat on it. You should have shut the school down before there were 50 cases. Because as we've seen with the variants, they are much more transmissible. So the odds of someone passing it on to someone else and then it replicating are much higher than it was just this past winter.
Thank you. So the county executive is spot on. I mean, we do see cases in the school, and there are kids that are in the community, so they can get infected in sports teams. They can get infected with, say, if they're play music and they're in a band, or they can get infected if they have an after-school job. They can get infected from being in the classroom. So they can get infected from a family member or a friend, doing something else fun. So there are multiple mechanisms for people to get infected, and if they're students in a classroom, if they are infected with COVID-19 and they don't have symptoms, they are in that classroom and potentially transmitting infection to other students. So the way we're counting it doesn't mean that they were definitely infected from the school just because we're counting it as a school-based case. However, we have had instances where we have documented that there has been transmissions in the classroom. So it just means to say that we still have to be vigilant, and we still have to keep masks on. I mean, with the new school guidance, masks are going to be required 100% of the time in the classroom. So those are things there is no place that is 100% safe, and we just have to acknowledge that and act accordingly.
Right now, I have to apologize to Kendra Schmidt. She's worked very hard this session. Sorry, Kendra. I think the last question, this goes to Sandra Tan.
Thanks. Just two quick clarifying questions. One, are you saying that Erie County vaccination sites will now take walk-ins? And my other question in regard to the new Bill Sabers policy, it sounds, and this has been touched on before, it sounds as if you're saying you'll need to have a smartphone in order to prove that you've been vaccinated, and I'm wondering if there's going to be any exceptions made for that.
We're going to work on it, Sandra, with regards to that. We do understand the Excelsior Pass is the best way to do it. We want to work on this to ensure, that's why we're doing this far enough in advance to ensure the practicality of it. If I announced this in August, 2 weeks before football season, it would have been a problem. So we're going to work on that to ensure that this is a system that works for all. And the other question was in regards to walk-ins. Yes.
Walk-in.
Our goal is, we will announce if walk-ins are available. We're not saying you can walk in. Appointments are still necessary. But if we have a site that is slow, if we were expecting 300 more people and we've got vaccine for it, we don't want to just have our folks sit there and do nothing. We'll announce that you could walk in and get vaccinated at that site, like I did yesterday. So it's going to depend on the location. That's why we're saying if you need an appointment, you want to schedule an appointment, appointments are available. You can schedule an appointment at your convenience. If we believe that there's an opportunity to announce that walk-ins are now being accepted at this site, like we did yesterday, we will announce it, because we don't want to have our folks anticipating doing 700 vaccines at a site and realizing we only have 400 signups, and there's 3 hours left and we could fit more people. So that will be a decision that will be on a case-by-case basis, because we don't want to say walk in and then have 600 people show up when we've got 600 already scheduled that are going to show, and we only have 640 doses. So that'll be on a case-by-case basis. With that, I think that's all. I want to thank everybody for participating today. Lots of information to share. Get vaccinated. It's as simple as that. I am like a lot of other people, sick and tired of having to deal with this. But that doesn't mean that we give up on it. We continue to fight. Our goal is to protect our residents and our citizens. If you don't want to get vaccinated, I can't stop you from not getting vaccinated, but you're putting yourself and other people at risk. Please get vaccinated. We know it works. It's as simple as that. This is not political. This is about saving people's lives. It's about ensuring that we return to normal as quickly as possible. You want to return to normal? Return to normal is not just going back and doing whatever you want and ensuring having only 50% of the population vaccinated. Returning to normal is ensuring all of us are vaccinated to protect each other. If you don't care about anybody else, you should at least care about yourself. Because if you're not vaccinated, you're at risk for catching the disease and dying, especially if you're an older adult. If you don't care about anybody else, you should at least care about yourself. And please get vaccinated. Be safe and well all. Take care.